Hi, and welcome to the Wayne Lemos podcast. I'm your host, Wayne Lemos, and we are on a final episode from the mini series Let's Make Psychology Common Living Culture. Episode a heads up on treatments for anxiety and anxiety disorders for the common man. Here we're going to be looking at CBT, exposure, acceptance, and DBT with a quick mention on psychiatry. However, before we do start, I would like you to also check out episode 3 with nutritional mentions. Nutrition plays a vital role and is regarded as extremely important if you're looking at it from holistic healing. So we start off with CBT. CBT stands for Cognitive Behavioral Therapy and it's used for social anxiety, generalized anxiety disorders, panic disorders, and with phobias. CBT helps a person recognize their negative thoughts and aids in them correcting them towards more realistic thoughts and hence changing their behaviors. To understand the process, we take a fictional character called Joe. Joe has negative thoughts and suffers from anxiety. His thoughts generally go along the lines of when he does get out, he gets lost. So Joe has to make a quick trip to London, and they're going to be looking at a sequence of three of his negative thoughts about the trip, and they're going to be looking at the realistic thoughts which he would be putting in over there in place of the negative thoughts. So negative thought number one, what if I get lost on my way to London? Here his cognitive distortion, which is a term meaning negative or irrational thinking, is predicting the worst. His more realistic thought over here should be the chances are slim of me getting lost. In any case, I can ask for directions. I got GPS on my cell phone, and I got Uber, Ola, and Bolt. Joe's negative thought number two is, but what if I get robbed on my way to London? There are a lot of criminal elements around the place. It's better I don't go. Here, Joe's cognitive distortion is blowing things out of proportion. He should be replacing that thought process with thinking that cards can always be replaced. I can always file a police complaint. There are cameras all around the places, and I got my family and my friends and all to support me. Joe's third negative thought in succession over here would be, but what if I do have to use a washroom urgently along the way? And over here we can see that the cognitive distortion is jumping to conclusions. Joe's brain is trying to protect him, as we saw in episode 1, and so it's giving him all sorts of irrational thoughts in order to keep him protected. He has to challenge this. He could replace this with the thought that I don't think I will have to use a washroom. In any case, there will probably be many washroom facilities along the way. Public toilets and even restaurants and stores have restrooms. With that example, we do get a slight understanding over there of how we replace negative thoughts with positive thoughts. As mentioned in episode 4 dealing with coping skills, in CBT we are replacing the train of thoughts from negative to realistic, and this would take a lot of practice. It has to be inculcated in daily life and be a routine. CBT could also include teaching you to recognize when you are anxious and the sensations you are feeling at the time, learning coping skills, and confronting your fears with exposure. This exposure could be in your mind or it could be in reality. Moving on to our second type of therapy, exposure therapy. Here we realize that people may go to extreme lengths to avoid an unpleasant situation that may not even exist or possibly never happen because of anxiety. Once again, we take our fictional character Joe. Joe is scared of water. He had a bad incident in the swimming pool as a kid. Over the years of Joe's brain trying to protect him, Joe now gets anxiety when he looks at bridges to cross, when he's crossing bridges, when he looks at large waves in the ocean on television, and even the thought of dark blue ocean water. Exposure therapy exposes you to a situation or an object of fear in gradual steps. Your therapist may conduct this via imagination or in real life. Exposure therapies can be integrated into CBT or on their own. It uses a process of systematic desensitization, step by step, with the mildly threatening exposures first, gradually progressing to directly start with the biggest fear would have been traumatizing. Once again, we are going to look at the example of Joe. In order for Joe to get over his fear of water and water bodies, his therapist suggests that he take up swimming lessons. So Joe starts off in the 4.5-foot pool. He may choose to learn it alone under a certified trainer, so no one else sees him learning while he's scared, or he might choose to learn with a lot of people around, so he feels more secure with his anxiety that he may drown. In any case, it's for him to get comfortable in his first exposure. From there, he will learn to swim and his brain will start to learn that it is okay and the fear should gradually decrease. The third therapy we're going to be looking at is ACT therapy, ACT, or acceptance and commitment therapy. This therapy has shown significant clinical changes in people pre-treatment and post-treatment. Unlike CBT, which replaces negative thoughts for positive thoughts, ACT teaches people skills to observe unfavorable thoughts and emotions and carry on in the direction of a chosen life. Here, the prime focus is to get patients to a life aim direction. Here, mindfulness skills are taught to perceive unwanted anxiety driven thoughts and emotions more effectively. Moving on, the final type of therapy that we are going to be discussing in this podcast is DBT. DBT is derived from CBT and it stands for Dialectical Behavior Therapy. It was developed by psychologist Dr. Marsha Linehan when she was treating patients for suicide and for self-harm who were hospitalized under her care. DBT can be looked at mixing the philosophies of CBT and acceptance. Here, a person under therapy can come to terms with where they are in the present, as with acceptance, as well as recognize the necessity and act on an intention of improving towards a more positive change. DBT helps a person in increasing their emotional regulation capacity. Lastly, in very brief mention, we will mention one of the types of medications in psychiatry. Here we are looking at SSRIs, that stands for Selective Serotonin Reuptake Inhibitor. SSRIs increase extracellular levels of serotonin by limiting its reabsorption into the presynaptic cell. SSRIs such as Prozac, Zoloft, and others can be purchased on prescription only under a registered MD psychiatrist. They go under many names depending on nation and depending on pharmaceutical companies. Here I emphasize, please do not self-medicate with psychiatric drugs. There's a whole episode over here on increasing your serotonin levels with nutrition. I'd advise you to please do check that out. And that's it for this concluding episode of the mini-series Let's Make Psychology Common Living Culture. This is the Wayne Lamos podcast, recorded for community, recorded for you. And I'm your host, Wayne Lamos, signing out. Thank you for tuning in. And I do hope that you will check out future mini-series and episodes as we get them on.